Okay, so today we will be covering the Secure Messaging Center and the client intake form. And so first of all, in this slide, what we're seeing in the box, this is the client view when they are holding the phone in their hand and they have the app. So they are able to scroll through and locate the portal straight from the app. When they are in the portal in their phone, they see the 4 icons. The first icon that we are focusing on today is the blue icon with the little envelope. That's the Secure Messaging Center. And I don't know how efficient this is going to be for me to navigate through, but if we are in the app, it's the top. So, we're in the app, you push the top left-hand corner here, and then it'll read web portal. You select web portal, okay. And then it takes you to the web portal, and this is exactly what you see. So they click on the Secure Messaging Center, and this is what initiates the client to send a message to their provider. Now, AJ, before we get into the details of how to utilize the Secure Messaging Center, I would love for you to talk a bit about how secure it is and why it's important that we communicate with clients and patients via the Secure Messaging Center rather than something like email or text or WhatsApp.
Yeah, sure. So email was never designed from the start to be a secure way to message people. It's kind of in the vein of original HTTP and FTP and all those other things that for the internet that were built back in the 80s and 90s that don't have encryption by default. And there are some email providers that do communicate with each other through encryption, but the standard protocol does not, that's not guaranteed. So you don't know what servers and systems the message has traveled across and who could have potentially seen it as it goes in transit from one location, from you to your destination, whoever you're sending the email to. So what we kind of have mirrored is what hospital systems do. There's a lot of different hospitals, where they say, oh, sign up for our patient portal. And from that portal, you can contact your physician or somebody at the hospital or clinic to communicate with them in a secure way. And when you use the Secure Messaging Center, there is a complete audit trail of the message originating from you and traveling to the system where it is kept encrypted in transit. And then when the person who you've sent the message to logs into that same system and retrieves the message, and it's transferred encrypted to their screen where they can read it. And we have, there's a complete audit trail of who sent the message, who read the message, and when. And it doesn't have to travel between multiple servers. It stays in one location. And that way you can be sure that it hasn't been passed along. You can kind of think of it as sort of like when you send a letter through the post office. The only way that, other than the envelope being sealed, it exchanges through a lot of different hands. And anybody could have, think of it like a postcard. Anybody could have looked at that postcard as they were handling it and processing it as it goes between different post office on a truck, etc. Whereas here it stays in one spot and we know exactly where it originated from and who has seen it.
Great, AJ, thanks for that explanation. So this is really technical. I love your analogy of a postcard versus a sealed envelope. We are covering our bases. We are designing this so that it can be implemented into a hospital or a clinic setting. It also allows fertility awareness instructors and coaches to interact with their clients at a professional level. Dealing with reproductive health, especially if a woman is working in conjunction with a doctor or going through an RRM treatment, this is very sensitive data. So we do want to make sure it's protected, and you can trust that it is protected in the ChartNeo web platform. So in addition to the GDPR and HIPAA compatibility, it's intuitive platform. It interacts much like email, as you will see, and it allows for an ease of access of the client files. So when you have a message, within a few clicks, you're able to view their chart, their intake form, any journal or session notes, so that you can give a comprehensive evaluation of their situation without digging through a bunch of client files. The first step that you need to do when allowing a client or a patient to message you is to enable the messaging component of the. We covered this in last month's webinar, so if you haven't already, I encourage you to go back and rewatch last month's webinar. But as a simple overview, when you have your client, you're on your client home screen, you click more for the particular client that you want to enable their messaging. And if you haven't already, so you do have the option when you are onboarding a client for the first time into your provider system to enable messaging. But if for whatever reason you haven't done that, or they went through a period where you disabled that function, you can go in and click more and then click enable messaging. That allows them then to send a message to you. So then from their end, they click the secure icon, the secure message center icon, and then it looks, again, as I mentioned, very much like an email inbox. So they will select compose new. From there, they go to the to. Now, if you are a single user, or am I saying that correctly, AJ? A single provider within a provider system, it'll just be default who this is to. For example, in my provider system, we have 3 coaches who work within one provider system. So what this looks like is they will click the drop down menu and they will select the coach that they want to select. Now, currently, as it reads, it's all within my provider system, and they have to specify the email that it is going to. But AJ, do you want to mention what we're kind of have coming down the pipeline as far as customizing the names within a provider?
Right. So we're going to have a feature shortly that allows you to change how this appears to your clients.
Yeah, so the hope is that you then have the ability to, instead of just having the overall provider clinic name or program name, it would read your name. So for example, this would read Melissa Buchan because this is my email. This would read Hava, and as this is her email, et cetera, et cetera. So then the client or patient selects who they want that message to. Now, when within a provider network, if they're sending a message to me, none of the other coaches in my provider system can view those messages. It is just secure communication between me and the person who sent the message. So they simply write it like an email. So who the message is going to, you pre-select who you're sending it to, test, hello, this is the test, and you send. And when you send, you will be notified through 3 ways. You will receive an email notification that you have a secure message in the Chartneo Secure Messaging Center. There will be an alert in the blue icon. You can see that there's one unread message, the message I just sent. And then there's also a red inbox alert in the dashboard. So this is signaling that you have messages that you need to tend to.